Hello, everyone, and welcome to our COVID-19 town hall. I'm Dave Min, and I have the privilege of representing the 1.1 million residents who live in California's 37th Senate District, which includes my home city of Irvine, as well as cities like Huntington Beach, Newport Beach, Costa Mesa, Laguna Beach, Tustin, Orange, Lake Forest, and Laguna Woods. I was elected in November of last year and took office a couple of months back in a very unusual time. But today I'd like to welcome you all to my very first town hall as a state senator. I'd also like to thank my friend and colleague, Senator Josh Newman, who chairs the State Senate Special Committee on Emergency Pandemic Response. He was instrumental in making this event happen. I'd also like to thank our panelists for taking the time to present your expertise. This is an important public service. For those tuning in on Facebook, you can go to my website to view this event with closed captions. My website URL is www.sd37, that's the letters SD, the numbers 37.senate.ca.gov. Now, we're in the second year of our pandemic, and we are reaching the limits of what our families, what our workers, what our economy can bear. This has been an unusual time for us all, and this has ravaged our economy, our society. As many of you know, I came down with COVID last month. I'll just say that my first week in the state Senate was a memorable one. We started our first session on Monday, January 11th. I took a COVID test 2 days later as part of the Senate's protocols. And much to my surprise, because I've been double masking and being very careful about going out, that test came back positive, which meant I had to stay in quarantine for 10 days. I thought this was a bummer at first because I couldn't see my family. I was pretty sure it was a false positive because I was asymptomatic for about 4 days. I started to feel very fatigued, but I still kept at work participating in hearings and taking meetings. But the following Wednesday, 1 week after I tested positive, that evening I came down with uncontrollable chills that turned into nonstop vomiting and really intense abdominal pain. I had to take an ambulance to the hospital, which was the first time I've ever been in an ambulance, and first time I've been hospitalized overnight. This was not a great experience. But as far as COVID-19 goes, I was very lucky. I did not have the respiratory issues, loss of smell or taste, or other symptoms that so many other COVID-19 patients get. I didn't need to be on a respirator. I was not near death at any point in time, even though it was a frightening experience. And that makes me so much more fortunate than so many others. We've all seen the statistics, and the timing of this town hall comes, of course, at a very grim time in our country's history, as nearly over 500,000 Americans have been lost to COVID-19, and over 28 million cases have been diagnosed nationwide. We are living through a once-in-a-lifetime plague that has upended our society, our economy, and the basic way that we live. Now, since I entered public office, I've heard from hundreds of folks in our community who are struggling across Orange County. Small businesses struggling to pay their employees or make their rent. Parents and workers who are having trouble paying their rent and mortgages. Restaurant and salon workers just trying to get by. Countless workers out of work and struggling to get EDD benefits. That's why my staff and I have been basically working nonstop since we started to try to fight for COVID-19 relief. In the less than 2 months since our district office opened, we've already helped hundreds of constituents get their EDD benefits. In 2 months, our staff has already helped more people than their predecessors did in the previous 4 years. As some of you may have read, I'm an author of a key bill providing $2.1 billion in grants to small businesses suffering because of the COVID-19 pandemic. I'm also co-author of a bill that allows businesses to deduct their PPP loans for purposes of state taxes. And we'll be introducing a bill that provides a sales tax credit for small businesses in the restaurant and hospitality industry, which of course have been hit particularly hard by COVID. The legislature, alongside Governor Newsom, has reached a deal that you may have read about that provides important relief for both struggling tenants and landlords, paying up to 80% of the rent owed by tenants who are unemployed or have lost income due to the downturn. We're discussing bills to help struggling workers and businesses every day in the state Senate. We know that folks need a lifeline to get through this time. But luckily, we can see the light at the end of the tunnel thanks to the rapid rollout of vaccines, and that's going to be a big part of what we talk about today. Vaccines are going to be absolutely critical in getting our state back on track. And at this point, I think it's fairly clear the evidence is there. The vaccines that we have offered are safe and they are effective, at least in inoculating against the main strains of COVID. Vaccine processes are ramping up and moving forward. We had some early hiccups in this state. No one can deny that. But quietly, we've ramped things up and we've become very, very efficient. California has now administered more than 7 million vaccinations, more than most countries. That's 7 million frontline healthcare workers and Californians over the age of 65 who are inoculated against this disease. This week, Governor Newsom announced that we will have 9 million more doses on the way. And we just had a state Senate conference call earlier with the governor's staff about this topic. And they're telling us that we should expect to see massive increases in vaccinations in the coming weeks. The state is working hard right now on building the infrastructure to make this happen. As of today, Blue Shield believes it has the capacity to deliver 2.7 million vaccines a week. Within a few weeks, this will be 4 million vaccines a week. So once that supply hits, we should see a massive surge in vaccinations. Here in Orange County, we've already administered 620,000 vaccines, and we have the capacity to do 10,000 vaccines a day based on availability, including at the super pods established at Disneyland and Soka University, as well as a number of mobile pod sites. Tonight, you'll hear about what the rollout looks like in Orange County and how you can get vaccinated when it's your turn. But before we get started, I did want to highlight a couple ways you can get vaccinated. Of course, there is the app offered by the county, Othina. It's like Athena, the goddess of wisdom, but with an O at the beginning for Orange County, Othina.com. The My Turn app offered by the state, and that is available at myturn, myturn.ca.gov. And for those of you who don't have access to the web, there are phone numbers available. We will be posting those later for those without internet access. But with that, I want to turn it over to my friend, Senator Josh Newman. Senator Newman represents California's 29th Senate district, just to the north of our district, with major cities including Anaheim, Cypress, Fullerton, Yorba Linda, La Habra, and Walnut. Josh has been leading our state Senate's efforts on the pandemic, and we're really fortunate to have him here. Thanks so much, Josh.
And thank you, Senator Min. So it is a pleasure to be here with you and with the panelists this evening. And so thank you for putting this together, and it's a pleasure for me to participate. So as Senator Min mentioned, I proudly represent the 29th Senate District, which includes 10 of Orange County cities just to the north of your district. And I also have the honor, as it were, of leading the Senate Special Committee on Pandemic Emergency Response. So in that capacity, we've held a number of oversight hearings, but probably more importantly on a day-to-day basis. I lead a working group that includes members of the state Senate, members of the Assembly, that meets on a weekly and sometimes more frequent basis with members of the governor's staff to talk about key issues affecting cities like yours. Initially, as Senator Min touched on, it was about transmission and about precautions, and it has been truly challenging for the well over a year now that we as a state, we as a nation have been grappling with the pandemic. And so we're encouraged now that we have done something remarkable in the United States in developing a vaccine, or now 2 and a third vaccine coming online, and I'm sure we'll talk about it. Developing vaccines that are effective, that utilize revolutionary new technologies, but having done so in a time span that is unprecedented and at a scale that is equally unprecedented. Typically, historically, it's taken sometimes up to 10 years to develop effective vaccines for disease. We did that collectively in 8 months. And so we should be grateful for that. The rollout of the vaccines in the U.S., but in California as well, has been challenging, right? So these are not simple logistical issues. The vaccines themselves require a substantial amount of very specialized care and equipment. And so it has not been without hiccups. And the state of California receives on a weekly basis an allocation from the federal government. And those allocations have been unpredictable. The recent cold weather in Texas had a huge impact on our ability to receive allocated vaccines. And then once the state gets those allocations, they then direct them down to the county level. So here in Orange County, our county health department has done a remarkable job in very challenging circumstances in developing the Othina Act, as Senator Min mentioned, but more importantly, in creating the infrastructure and managing the programs to ensure that we're getting vaccine out as quickly as the federal government is supplying it, and we've done that. As Senator Min mentioned, We've been told that we should expect much higher levels of vaccine over the coming weeks. I've learned to take this news with a bit of caution, but even so, we have at the same time developed substantial capacity within California. As Senator Min mentioned, the current capacity is somewhere on the order of the ability to deliver over 2.5 million doses per week. That's important because what we're aspiring to do is to get vaccinated something on the level of 75% or more of California's 40 million residents to reach, that concept of herd immunity, the point at which enough people have substantial immunity to the disease that we start to close off the pathways for transmission. And this is important, and it's in fact, you can think of it as kind of a race against time, because in recent weeks, as you may have read, we have identified a number of new variants of the disease, of the coronavirus that are either more infectious, but there's significant concern that they may also be more virulent and potentially more lethal. And so it becomes more important than ever that we get Californians vaccinated as quickly as possible in order to lessen the chances of those strains propagating and becoming dominant and undoing some of the progress we've made thus far. So capacity is different than supply, and we're working through that. And one of the measures we've taken at the state level over the last couple of actually month, give or take weeks, is the state has entered into a relationship with Blue Shield of California to transform and manage the entire state system. Because as you can imagine, Orange County has a population of about 3.4 million people. We have not always been successful at getting vaccines to those populations that have been most impacted. And you have a very difficult set of choices to make when you think about the imperative, right? We're working on getting to herd immunity, but we don't want to let efficiency come at the expense of equity, which is to say there are communities that have been especially hard hit. We have to make sure that those populations that either have underlying conditions or work in at-risk occupations are not left at risk of exposure and transmission and all of the consequences that come with suffering from COVID. I sometimes think that one of the reasons I was offered or asked to be the chair of the commission is like Senator Min. I also had COVID. I don't like to brag, but I had it before Dave. And I got COVID the same way, super careful, right around Thanksgiving, and still unclear as to where I might have contracted COVID, but had my own relatively minor experience, very lucky, although I did lose my sense of taste and smell, which was one of the more disturbing experiences I've had recently. And then I was fortunate enough to be referred into a clinical trial for the Regeneron monoclonal antibody cocktail. And they told me there's at least a 2 in 3 chance that the IV I got was the actual stuff. If not, that the placebo effect was probably very strong if I got a placebo, because I was negative within 5 days. And so I would urge anybody with symptoms when you test positive, if you're within that 8-day window or so, make sure that you very clearly ask for the monoclonal antibody cocktail, because it has a proven efficacy. And unfortunately, because of the demand in hospitals, it's quite often been the case where people aren't offered the opportunity to accept, even though hospitals have substantial supply. So we'll be hearing from some experts in the field, and we'll be taking some questions. Glad to be here with you. And I want to just take one moment to just reiterate what Senator Min said. Like, he and I both had COVID. We're both very lucky. But there was no assurance whatsoever going in that I was going to be fortunate. I had one of my good friends from childhood who passed away last Sunday, 1 year older than me, apparently super healthy, had the opposite experience and got sick, was intubated, was in an ICU, and then appeared to get better. And then within the span of about 4 days, had an intense backslide and wound up going in for surgery and passing away. So we cannot take for granted, even if you're healthy, even if you're careful, you have to take all precautions. And the life you save won't just be yours. It's all the people whom you may expose along the way. So that's why we're here this evening. And so thank you for having me.
Thank you, Senator Newman. I'm sorry to hear about your loss. But with that, want to move on to our panel. We have some tremendous panelists with us today. I'll just briefly mention who they are and then introduce each one in turn. We have with us Dr. Helen McPhee, who is the Chief Transformation Officer at Memorial Care. She'll speak first. Then we have with us my former colleague, Dr. Andrew Neumer, Professor of Population Health and Disease Prevention at UC Irvine. And then last but certainly not least, we have Jenna Jensen, who is the Chief Government Relations Officer at Chalk Children's Hospital. But first, we'll start with Dr. Helen McPhee, who's a national expert in patient safety with over 20 years of experience designing hospital pharmacist services. She herself is a doctor of pharmacy, and she leads Memorial Care's vaccination rollout across 4 hospitals and has to date successfully administered more than 40,000 doses throughout Long Beach and Orange County through those facilities. She's going to talk a little bit, and she'll be able to answer questions later on what the vaccine rollout looks like here in Orange County from the perspective of our local hospitals and staff. Thank you so much for joining us, Dr. McPhee.
You're welcome. Would you like me to proceed now? Great. Okay. So, hi everybody. My name's Helen, and I'm so pleased to be part of this conversation tonight. I'm good to work for Memorial Care, and we've been part of the vaccination effort on the healthcare sector side. We have, as Senator Newman mentioned, we have 4 hospitals, 2 of which are in Orange County, and really actually 24 vaccination sites across the county between our medical groups and our hospitals and other areas where we can get the vaccine. So a couple of things that I was asked to speak to tonight as we kick this off. How many vaccines have we received, and what does it look like for us on the ground? And can I provide an overview of the region supply? I think both senators accurately depicted what it's been like. It's been a little bit chaotic, although amazing that we've done what we've done in the last 2 months, right? In the middle of December is when we got our first vaccine. So pretty quick, just not fast enough, of course. And we're so pleased everybody wants to get a vaccine dose. That's great. The current allocation system, as you mentioned, has been kind of a multiple step process. So by the time it gets to us, we basically wait for Dr. Chow and the Orange County Healthcare Agency to decide how much vaccine we're going to get. And it's day to day. And I can tell every week we're like, can we please have more? And we've been doing what's called burning to zero, which means giving every single dose we can. And so we've actually given at this point, just to revise those numbers a little bit, over 45,000 first doses and over 60,000 total doses, because of course the vaccines have been the frozen variety, either Pfizer or Moderna. And we've done a great job there, I think, partnering to do that. I think another question that has arisen is, who is eligible and what kind of vaccines are we using? So we have learned fast how to work with both Pfizer, which is that ultra cold, as Senator Min said earlier, you really have to watch what's called the cold chain, meaning make sure it stays in the right state, and it's very, very fragile, if you will. So we have pharmacists like myself, but others who are making sure that it's stored correctly and maintained well. And then Moderna, which also is frozen. That's one of the exciting things about the J&J vaccine, if that gets approved, because it's a little bit easier to give, and we'll have to, see how that gets approved and what for. But I think that will sort of add something to our armamentarium. So we've been in what's called phase 1A, as I think most folks know, that was healthcare workers primarily, as well as long-term care. And we've had a very good experience with that for Memorial Care. 85% of our healthcare workers and doctors elected, it's voluntary, to get the vaccine, which is a pretty high adoption rate. And we've done a lot of work to take vaccine hesitancy and turn it into vaccine confidence, which I think is a key opportunity to help people understand. There's a lot of myths out there. People heard about vanish point syringes and thought that meant that the vaccine vanishes and doesn't get given. They think because mRNA sounds like DNA, it might alter your DNA. They think that there's a chip in the vaccine that somehow it's going to, follow you around on your phone. And there's a lot of opportunities to help people understand. And there's some deep-rooted, community-based worries about vaccines and testing and the like. And you have to really get with people. And so we'll talk about that a little bit more later, I think. So we've moved from 1A to 1B. And 1B are where we can actually vaccinate the 65 and older, as you mentioned. So we've actually had some great experience with that already, both vaccinating those patients that come to us at our hospitals and our pretty large number of medical group sites and the like. but also working in partnership with the communities out there. So we've had an opportunity in some of your districts, very happy to mention, that we've been able to partner with people who came to us and also with of the agency, the healthcare agency, to go in there and really sort of deliver vaccines to that population. I think that some people can line up at Disneyland or SoCaU or Anaheim now, Convention Center, but that's not for everybody, right? And a lot of the people in that 65-year and up group, and in the coming group in March, where we're allowed to do people with certain conditions, they're not feeling well enough or able to go stand in lines, navigate the parking lots, do all of that. So I think one of the things that we're most interested in at this point is working with people in the community to see where can we help and bring it to use. So, for example, in the city of Laguna Woods, we've done over 8,000 seniors where we went in there, worked with the staff that kind of managed that community, and they worked with us to bring people to a central area. We brought all of our folks in to give the vaccine, record the vaccine, make sure it's safe. Pharmacists, again, making sure it was ultra cold and all that. And then we're going back for dose 2, actually starting this weekend. So we're happy about that for those seniors. So kind of a high touch, high service option. And we're very interested in the equity focus. I'm sure we'll get back to that on this panel. And so now we've been reaching out, we've been talking, and we'd love to talk to any of you all, to city mayors, superintendents, community groups. So we just did a pop-up last Friday in Irvine at a senior center there for the frail elderly who they identified to be at risk and not able to really get over to a super site. And so we did 200 doses in a couple of hours, and really amazing experience. I got to stop by there, and it's like one of the things that gives you joy.
I appreciate that, yeah. And that's great, and we look forward to hearing more in some of the Q&A, but I did want to give Dr. Neumer and Ms. Jen Jensen a chance to speak here really quickly. Our next panelist is Andrew Neumer, as I mentioned, Professor of Population Health and Disease Prevention at UCI. He's a researcher of the 1918 influenza pandemic. He's a top public health expert. You've probably seen him on your TV screen or quoted in major news outlets at some point. Today, much of his work is focused on COVID-19 and mortality from pandemic infectious disease. And he's one of the leading subject matter experts on the science and research aspects of the novel coronavirus. So thank you, Dr. Neumer, for being here.
Thank you, Senator Min, and thank you to both yourself and Senator Newman for having me on this town hall. I just have a quick two-pronged disclaimer that I do at the start of all these events. The first is that I'm a apolitical scientific expert, and the second is that I have no financial or other conflicts of interest. And thank you all for joining us this evening, or if you're watching this on tape delay, then whenever you're joining us. I'm an expert on influenza, as the senator said, and there have been a lot of comparisons of COVID-19 and influenza. And one of the things that's important for people to understand is there are many respects in which this pandemic is similar to a pandemic of influenza. More severe than the 2009 pandemic, which a lot of you probably remember, and less severe than the 1918 pandemic, which none of you remember. But there's also aspects in which COVID-19 is different than influenza. And so to understand what we're going through and to do our best to predict the future of the pandemic, we have to draw lessons from flu, from which we have a much larger knowledge base, where those lessons are applicable, but also be certain to maintain the distinction between SARS-CoV-2 and influenza virus. And the one key thing is that we're immunonaive to SARS-CoV-2. The population 12 months ago, nobody had antibodies yet. And that's why vaccination, the principal topic of tonight's town hall, is so important, because vaccination gives us a shortcut to immunity. Even in the devastating 1918 flu, people had antibodies to flu because there was flu in 1917 and 1916 and so on. There was no COVID in 2017 or 2018. So that's a huge difference, and that's why vaccination is so important. And I look forward to talking more about this.
Thank you, Dr. Newman. Really appreciate it. Finally, our last speaker and panelist is Jenna Jensen, Chief Government Relations Officer at CHOC Children's Hospital, obviously an important institution in Orange County. Jenna has over 20 years of experience spearheading CHOC's legislative advocacy efforts. As Orange County's first hospital devoted to caring for children, CHOC is obviously a pillar in our community and is one of the nationwide leaders in pediatric healthcare. Jenna will share with us some of how COVID-19 impacts children and how we can work to better protect our children. Thank you so much for joining us, Jen.
Thank you, Senator Mann, and it's really a pleasure to be on this panel with both you and Senator Newman and the other incredible speakers. So I'm really honored, and I'm glad people are tuning in to learn more about this. It is so important. And I'm glad we're talking about vaccines. You can never talk too much about vaccines, COVID or not. We love talking about the importance and the blessings of vaccination for civilization, really. But so happy to talk about that. Happy to talk about the impacts of COVID on kids, and really appreciate you adding me to the panel to talk about kids. I think mostly what we hear is that COVID doesn't affect kids as much, and that's true. And I can share the data later as we get into the Q&A period about the number of kids that have been infected with COVID. So generally, it's true that fewer kids are getting infected with COVID, that much fewer are dying from COVID than adults. But that being said, we still have seen some very sick kids with COVID at CHOC over the course of the pandemic. So it's important to know that it's not that children are unscathed by this. They definitely are affected by this. They can get very sick. And we can talk about more how that shows up, but it is true that children are affected by it, but in lesser numbers. And then the impacts of COVID go well beyond just kids getting sick. So we've had kids out of school. We've had kids, having their schools shut down and moving to remote learning, not being able to socialize, is really hard on kids. We've had kids missing their well child visits, and that has all kinds of impacts that we're really worried about. We've seen reduction in reports of child abuse, and we're pretty sure that's not because there's less child abuse going on. What we fear is that it's just not getting reported because kids aren't in those settings where those things would be reported. We've seen really troubling escalation in demand for mental health services among children and adolescents during the pandemic, just as we have in adults, but it's been startling. And that started very early on in the pandemic, and we have an inpatient mental health unit at CHOC, and it has been full since the beginning of this pandemic. Typically, we see sort of softening of demand, so less kids needing mental health admissions during the summer months when school's out of session and the stress is maybe a little bit less. But this past year, there was no let up. It was full all summer. So kids and teenagers are really suffering in some very serious ways through this. And I think those impacts are likely to continue beyond the horizon of this pandemic for some time. So we're going to need to be looking at mental health for kids and teenagers for sure. But I can talk more about that. I have served in CHOC's COVID-19 command center as liaison officer since we opened up the 16th of March. So I have, smarter people than me around me all day, most of the week talking about these things, and I look forward to answering any questions.
Thank you so much, Jen. I appreciate that. So now we're going to move to Q&A, and we'll be taking questions from the comments on Facebook. They'll be relayed over here, but we've got a few already. And so, Senator Newman, why don't you take it away?
Thank you. And so I'm going to address the first two. They're kind of related to Dr. Neumer. And the first is, Dr. Neumer, from Mark in Huntington Beach. Once a person is fully vaccinated, how long does the conferred immunity last? And the second question is from Diane in Newport. If you've had COVID-19, should somebody still get a vaccine?
Those are great questions. So for the how long immunity lasts, I don't have a very satisfactory answer because it's the truth is that we don't know. We have every reason to believe, based on the antibody levels we're seeing in vaccinated individuals, that it will be quite durable. But I mean, we can't say it will last 10 years because we don't have 10 years worth of data. I mean, medicine is an empirical science where we use data to answer questions. And so, I mean, it's something you can rest assured that it's something that the FDA, the NIH, and the CDC are monitoring very closely, and we will know if and when boosters or additional vaccines are necessary. But honestly, I can't answer that question definitively because nobody can. As far as remind me the second question.
So the second question is if somebody has already had COVID-19, do they need a vaccination?
The protocol is to wait 90 days. The antibodies that person has from having recovered from COVID will protect them for 90 days. And after that, and will possibly also interfere with vaccination. And after that, they can receive the vaccine. And there's some debate going on right now in the scientific community about whether or not only a single dose is required for those people if they're receiving the Pfizer or Moderna, which are typically 2 doses. And the evidence seems to say that having survived infection is sort of like the first dose. And so having 1 dose for those people is sufficient. But people who have survived COVID can get vaccinated. They are authorized to be vaccinated, and they are authorized to receive 2 doses if they prefer 2 doses. They're just supposed to wait 90 days.
Thank you.
Thank you, Dr. Neumer. So I've got 2 questions for Jenna, and from Scott in Laguna Beach. Can kids get COVID, and sort of what's the risk there? And then James from Irvine asks, what does transmission among kids actually look like?
So kids can definitely get COVID. They can be infected with it. They can get sick from it. They can transmit it to other people. They definitely can. So the answer is yes. Across the country, CDC is telling us that about 12% of COVID cases in the United States have been among children. So it's not the majority of cases, and that's among kids ages 5 to 17. But they definitely, kids can get sick. At CHOC, we've seen more than 4,000 COVID positive pediatric and adolescent patients. That's kids that have been tested in our system at CHOC. So 4,000 there. 412 of those have been hospitalized. And out of the 412 that were hospitalized, 83 were sick enough to need to be in the intensive care unit. So some of them got very sick. We've also had 63 confirmed cases of MIS-C, which you may have heard about in the media, multisystem inflammatory syndrome of children. So this is something that we see when children have had COVID, and sometimes these can be cases where they didn't even have any symptoms. So they could be completely asymptomatic with COVID. And then 3 weeks later, we see them coming into the hospital really sick with sort of Kawasaki's disease-like syndrome. And if you've not heard of what that is, it's an internal inflammatory process. So symptoms include fever, neck pain, abdominal pain, rash, vomiting, bloodshot eyes, diarrhea, and fatigue. And some of those kids are needing to be in the intensive care unit. So again, 12% of cases, but some kids get hit really hard with that. Transmission in kids looks pretty much the same way as it does in adults. So, this is a disease that's transmitted via respiratory droplets from an infected person that get, sort of inhaled in by somebody. And kids that have asymptomatic disease, which a lot of them do, can still transmit COVID. So transmission is pretty much the same as in adults. So kids need to be doing the same kind of non-pharmaceutical interventions that adults do. Need to be hand washing, need to be avoiding crowded indoor spaces, need to be wearing masks. All of those things that we're recommending for adults are the same things that kids should be doing.
Got it. And I think Senator Newman has the next questions, but I just want one quick follow-up.
Sure.
I mean, there's a robust debate going on around, what the distancing should be between children. Does there need to be distance? And if so, is it need to be 6 feet? Can it be less than that with children because, they might have a lower transmission rate? Sort of what would you say is your guidance here?
I'm still hearing 6 feet, to be honest. And I think especially as we're entering into conversations about wanting to get schools reopened, that, it's better to be conservative. We want to be able to reopen schools and we want to do that safely. So I think sticking by, that 6 foot distance is probably the best way to go.
Thank you. Senator Newman.
Okay, thank you. So next question is for Helen McPhee. So we talked a little bit about herd immunity. And so at the current phase of vaccines, there's no shortage of demand, but we have to be concerned as we move forward about vaccine hesitancy. And so what should we do? How should we think about the lack of confidence in vaccines or clinical trials? And then what are you finding at Memorial Care are the best and most effective ways to reach people and either to reach them to give them vaccines, but also to convince them that it is necessary and useful?
Yeah, those are great questions. So I think the thing there is that the decision to get the vaccine is personal, right? And people have to put that in context and they have to believe that it's important. And of course, some people don't necessarily believe in COVID, and so then they think, well, the vaccine may pros and cons. Other people, really are worried about it and want to get first in line with the vaccine. And there's everything in between. So I think that what we found to be the most effective is to really have that conversation with people one-on-one, which means giving them opportunity. And really the best process that we found is having what's called a trusted messenger model. So many people, trust their doctor, their nurse, their pharmacist, but they also trust their community leaders. And so partnering with the pastor of the church or the person who's in the community health organization or community support organization that already knows those people and doing a joint town hall or really one-by-one, and just making sure that we can answer people's questions. And the other thing is publishing in languages that people understand and can read. And sort of making it less of a passive approach. So that's what we've been doing in many of the areas. I know we're going to be, we're working on a clinic in Anaheim. We're going to be doing it in a church, and we're going to connect with the pastor of the church there and get in front of that with the folks that are going to be asked to come there, frail elderly, and go up front and make sure they understand what the risks and benefits are and have a chance to answer those questions. So I think this is the difference between a super site approach and more of a tailored service-oriented approach, because if we're truly, as you said, going to get to herd immunity, we need to get to as many people as possible. I mean, that 70% rule, hopefully, and as fast as possible. So we've got, 3 or 4 months to get this done, in our opinion.
Thank you. Senator Min.
Dr. McPhee, I actually had a couple of follow-up questions for you on that note. So these are related questions, but what is your strategy for making sure we vaccinate vulnerable groups? And then we just got a question specifically that's a subset of this from Karina. For those seeking vaccines due to high-risk chronic illnesses such as autoimmune disorder, how would they go about securing an appointment?
Yeah, great. So on the vulnerable settings, I think that really requires, again, it's almost the same answer as it takes partnership. So it's many people are not as comfortable navigating an app. So of course, as you heard earlier, you can go online and have somebody help you do that. But a lot of times it's that they A, have to decide they want to get the vaccine, and B, get some help enrolling and getting signed up. So we believe that going out into the community, and I know Chalk does this as well, is really helping people understand and take it to them. So when we did, for example, Laguna Woods, we basically took the population and said, all right, there's 8,000 people here, but 61 of them are homebound in that age category. And we basically boarded buses with our doctors and nurses and the vaccine and took it to them where they were living, which is really high touch, because then you're going to wait for 15 minutes to make sure they don't have a reaction. And so really helping those folks through the process. Did that similarly again in some of the, as we're getting a little more vaccine now, we can take it to those communities. So I think it is community by community and partnering with the leaders there who know who these people are, where they live, how we can get to them. So that's kind of one, I think, big strategy that has to be added to everything else that the county is doing. I think the other one is on the high-risk condition. It's a great question. So starting March 15th, if you probably are aware, there's a list of conditions, including, for example, if you're pregnant, diabetic of certain levels, if you have cancer that's active and under treatment, those kinds of things. There's a list of them. And really, our opinion on that is that's going to be difficult to screen for at a super site. That's probably better done through your healthcare provider, where we can monitor you for all the signs and symptoms of what you're going through with your disease management and give you the vaccine safely. So what we're planning to do with that, and as we get more vaccine liberalized and starting in March, we'll be actually making appointments for those people and reaching out. So we have, as many health systems do, an electronic medical record process, and we can actually go through those charts and understand who fits into these categories and do a more active reach out to those people. And then finally, for anybody who wants to, you mentioned earlier, Senator Newman and Senator Min, the ability to get on an app to register. You can do that now. Even if it's quote unquote not your turn yet, you can go on to the app, register, and it will tell you when it is your turn and reach out to you. And you've given them your phone number or your email. So I think everybody can start to do that. And I guess the last thing I'll say is, I'm not quite sure what's going to happen with the Athena app. I know the state is moving to My Turn, and we will have our sites registered on My Turn. And as we have clinics available, people will be able to see those, and as we have spots available. So again, I just suggest people go ahead and register, and as soon as that dose comes up, you might be get really good news today and be able to come on in.
Thank you so much.
So I have a question for Jenna, but let me respond real quickly. With respect to the Athena Act app and kind of the state's broader program, so they're currently working on strategies so that app, those apps that have been developed, will speak and share data with the state's broader platform. So it's a work in progress, but the work that Orange County has done won't be for naught, and hopefully it's a fairly seamless transition. I want to ask a question to Jenna Jensen from CHOC, and it comes from Amanda from Tustin, and it's about children, right? So she writes, her kids are worried about COVID-19. What can I do? And I want to emphasize, above and beyond the actual physical risk, there's been a huge kind of psychological impact on children. So how do we think about, how to convey to children, how to manage their expectations, manage that experience as we work ourselves through this, this very challenging time? If it's challenging for adults, it's got to be massively challenging for kids.
Yeah, and I know both you and Senator Min have kids, so this is probably something that's playing out in your own homes. So I was able to speak to our mental health team at CHOC, and they've got some blog posts on this. So please, I would encourage everyone to go on our CHOC blog and take a look at some of the content that our mental health staff and our child life staff have put on there. There's a lot of different topics about addressing disappointments during the pandemic for kids, how to address those things, how to create activities and diversions for kids. So there's a lot more content than what I could cover here. So I was able to kind of pull together sort of a top 5 tips for parents to think about how to address kids about COVID. Whenever there's something stressful going on, kids absorb much more about it than we think they're going to. They're always listening. They're picking up media that we don't know they're paying attention to. They're processing it in ways. They may be even hearing things from their friends. So it's better to take action proactively to communicate with them instead of waiting until they've got all these rumors in their heads that they've been worried about for days. So number one, welcome your child's questions. Make them feel heard. Allow them to get fact-based information that is likely to be a lot more reassuring than some of the rumors they might be hearing from friends. So just listening and making yourself available to answer questions, taking cues from your child. So making sure that you're not prompting questions, but being available to answer questions, and try to avoid encouraging frightening fantasies. So not providing more information than they need, but actually answering the questions that they have. One that I think is just a really good tip, and I thought, gosh, I wish I'd had this when my kids were little. My kids are all grown up now, but dealing with your own anxiety first. So if you've just received some troubling information, or if you've just seen something that kind of sets you back on your heels, this isn't the time to go talk to your kids. So, take a minute for yourself to process what you've heard, to kind of process your own anxiety, calm down before you're going to go have a conversation with your child about something. So it's like, put your own oxygen mask on first before you put your kid's oxygen mask on. That advice you hear on an airplane is good advice in everyday life too. Focus on what your family is doing to stay healthy. So talk to your child about, yes, we are concerned about COVID, and there's a lot of things that we can do to keep ourselves safe. So we're wearing masks. This is why it's important to wash our hands. This is why we're doing all these things that we're doing, is that we can have some control over this. This isn't completely out of our control. And children like to hear that there's something we're doing that we can have an impact, and we're not just completely at the mercy of this situation. So really emphasizing what we can do as a family to stay safe and to stay healthy. And then really pay attention to how much media is on in the house. And that's good for grown-ups too. So check yourself on how much time you're spending on social media, on how much time the TV is playing, on how much CNN or whatever news media you're consuming. A little bit is good, too much is not good. So pay attention to how much media is finding its way into your house, because you need a break. So those are 5 tips, but go on our Chalk blog. There's a lot more content on there.
Thank you. Really good information. Appreciate that. Senator Min.
Thank you. I've got a couple questions for Dr. Newman. I'm going to merge a few different questions together. With respect to the different variants that we're hearing about, whether it's the UK or the South Africa or the California variant that we're just hearing about now, how dangerous are those? How effective are the vaccines, both the ones that we've seen, that are out there right now, as well as some of the ones that are being developed in addressing both COVID now, but then also some of the new strains that we're seeing?
Great question. First of all, let me say probably the most important aspect of this first, which is that these variants arise when someone gets infected, the virus mutates, and then they transmit a different form of the virus when they transmit it to someone else. So these variants arise from the virus's natural tendency to mutate, plus the churning that this virus does in the population, infecting different people. So the best way we can ensure that some new variant, the Irvine variant, doesn't arise that is more dangerous than any of the ones we've seen so far, is to vaccinate ourselves against the current virus. Get vaccinated. There'll be less churn of the virus in the population. The rate of these emergence of new variants will slow down. And that's really the best thing, we can do for ourselves and each other. So vaccination is really the key here. Now, as far as the variants, that we already do have, the B117, the so-called UK variant, it seems to be more spreadable, but it doesn't cause more severe disease than sort of the original SARS-CoV-2. We're seeing tremendous declines here in California in transmission, and in spite of the fact that the UK variant has been detected here. So, these variants are certainly the number one concern, but the UK variant isn't really keeping me up at night. The California variant, we just don't have a lot of data on that. There was some pretty ominous headlines recently about it, but again, we're seeing a tremendous decline in severe cases, in transmission, in hospitalized cases, and even in percent positivity, while this new California variant has emerged, which seems to suggest it's not, going to be an explosion of yet another wave. And the South African variant of the ones that have received the most attention seems to be the greatest cause for concern because it evades, it potentially evades the vaccine a little bit better, and it evades some of the monoclonal antibody therapies that we heard about. And so, that is the most worrisome, but, our best evidence suggests that vaccination, even if it offers less protection against the South African variant, it will still offer some. And moreover, the South African variant isn't widespread in the United States. So, I would just go back to the top and say vaccination is key. Yes, the variants are worrisome, but stay tuned. But it's not something that we can't get the upper hand on.
Got it. Now I've got a related question. This comes from Josh in Fullerton, which is Senator Newman. But we've all heard about the Johnson & Johnson vaccine, which has a lower efficacy rate than the Pfizer and Moderna vaccines. But it is a single dose. It does not need to be in cold storage, according to reports. So it's obviously easier to distribute. What are the pros and cons, in your view, of the Johnson & Johnson versus the ones that are out right now for distribution?
Well, the pros are it's a single dose, so it may be highly appropriate, especially for people who've survived natural infection. It has a much more lenient storage characteristics, so it will be easier to get it out to more people, particularly in rural areas. Obviously these districts aren't as rural, but across the state we have very diverse populations, and it's single dose, and so that's helpful because some people will miss their second doses, and with the Johnson & Johnson, that's just not an issue at all. And globally, we'll have an impact as well for the same reasons, and we have to scotch this virus everywhere because we're gonna have reintroductions, over time here as well. So it will have a big impact there. I think it will. I expect the J&J vaccine to be authorized by the FDA probably next week, and so it will be available in the United States. And I think the best strategy is to take the first offered vaccine. So if you're offered the J&J vaccine, my advice would be to take it. But you did say in the documents that have been shown in the clinical trials that it is slightly less effective than Pfizer and Moderna, and I wouldn't presume to try to hide that from anybody. I mean, your constituents should know that it does have, despite its advantages, it also does have a disadvantage.
So I guess the question then is, how do we convey to the public that this is not like a second-class vaccine? It's the rural vaccine, which has a lower efficacy rate.
Well, I mean, again, my advice would be to take the first vaccine available. Although as we heard earlier in this town hall, the millions of doses of the two already authorized vaccines, that is to say the Moderna and the Pfizer, are on their way to California. And I mean, I would take the Johnson & Johnson if it was offered to me. I'm as yet unvaccinated, and so it's not a second-class vaccine. It has perhaps a slightly different application. I believe that in the long run, the best way to combat vaccine hesitancy is to have lots of transparency. And so to have the clinical trial data available for people who are interested to see it. These trials were conducted with taxpayer dollars, and people have the right to know what's going on. And so, not to say something that's not true about the Johnson & Johnson vaccine, but to just to be candid.
Yeah. Well, I appreciate that answer, Dr. Newman. My understanding is all these vaccines have historically high rates of protection compared to other types of vaccines. With that, I want to just give all of the panelists an opportunity to answer one question that I think, I'd love to hear your answers to. You've got 2 out of 40 California state senators here, so that's 5% if my math is correct, and that's a pretty good ratio. What would you like to see? If you could tell us one thing that you'd like to see the state do or do differently in response to the pandemic from your different perspectives, what would that be? So why don't we start with Dr. McPhee here?
Oh gosh, can I just pick one? No. I think that, one, I think really important message right now is because we're not at herd immunity. For those that are able to get the vaccine, and as more and more people get it, we actually just added this to our code of conduct for our staff and doctors. You have to remember that you still need to use all the safety practices for all the reasons that Dr. Neumer mentioned. So still wearing a mask, social distancing, what Jenna said about the schools, and really continue to message that out to everybody, because the issue with it is while you're getting vaccinated, especially with the 2-dose vaccine, you actually can be shedding virus. And with the variant issue, you don't really know of what's going on. So if we're going to lick this thing, we all just need to follow those practices until, officially we say it's over, which we're long haul away from that.
Thank you so much, Dr. McPhee. Jenna?
I'm just, I have been so worried about mental health since the beginning of this. I called our chief psychologist, I think week 2, and said, Heather, this is Dr. Husty, I said, we're going to see some really serious stuff going on. I just think it's going to be really bad, because you think about the stress that families are experiencing, especially families that in those communities that have been hardest hit. And these were families that were already under a lot of stress, financially, and dealing with, sort of disproportionate impacts in a lot of areas already. And this has just made those things so much worse. So when families are stressed, kids get stressed, and that can lead to anxiety, depression, and ultimately it can lead to things like self-harming, suicidal ideation, substance use, and all of those things, if they're untreated, they lead to adults who have problems with crime and with homelessness, and all kinds of issues that we see in adults that have untreated mental health needs. So I think that what I would ask is, we already saw the governor in his January budget propose some funding for school-based mental health and for increased access to mental health services for children and teens. I would say we would sure love to see that make its way into the final budget. I think this is an investment we have to make. The impacts of this pandemic on child and adolescent mental health are likely to stretch well beyond 3 to 5 years after the horizon of this pandemic. We've looked at data from other natural disasters and other pandemics in the world. And in situations where it was a much shorter duration, they saw at least 3 to 5 years out from the main event. They saw mental health impacts. And look, we've been a year into this. So I think we've got to be ready to be dealing with this for some time in the future. And this generation of kids, we have to rely on them to solve a lot of problems. There's going to be climate change issues that they're going to be dealing with. There's going to be equity issues that they're trying to be solving. And we need them to be well, and we need them to feel well, and we need them to have good mental health. So we need to start really investing more in access to mental health services for children and teenagers. We owe that to them, and we owe that to our world.
Thank you. Appreciate those comments. Last but not least, Dr. Neumer.
Thank you. Well, in addition to the comments of the other panelists and dovetailing with what Jenna said, I'd like to see teachers, every teacher in the state offered a vaccination before we go back to school, because there's been a lot of anxiety among teachers. And I agree with Jenna that, we want to start schools as soon as, can be done. But teachers should have been offered a vaccine by the time that happens. And just in general, I think, we want to get everyone offered a vaccine in the state who's eligible, which means 16 and up at this point, and do that as quickly as possible for the reasons I mentioned earlier. So what I'd really like to see, is, Disneyland is great, and these mega vaccine sites are great, and they can do, over 1,000 people per day. But I'd also like to see just opening up normal channels like HMOs, Kaiser. Kaiser insures 9 million Californians. A lot of people are really comfortable at getting their shot from their Kaiser office or at a pharmacy, a retail pharmacy. I mean, so put people in their comfort zone to get the shot where they want it, not at the expense of shutting down the mega sites, but we need to start opening up additional channels, and they need to be. We don't need to reinvent the wheel for that. We should open up the normal channels. The HMOs know who their insured people are, which is not to say that uninsured people should be left to their own devices, but the HMOs can reach out to their covered populations. We should reach out to people who don't have HMO coverage and get them into a pharmacy or get them into someplace, but just expand vaccination, and don't reinvent the wheel, just do what works.
Thank you, Dr. Neumann. Appreciate that. I also just want to note that I know there were a number of questions from folks in the audience that we did not get to. We will try to get to you, my staff and I, with the appropriate information if we can. With that, I wanted to give Senator Newman the opportunity to close here.
Thank you, Senator Min. So thank you to the panelists for being here, and thank you for all of you who've joined in this evening. And the fact that you're here is proof that you are committed to being involved in getting through this together. So one quick point to Dr. Neumer's very reasonable recommendation. That is, the extension of vaccines to HMOs and to community clinics is something that the state is actually working hard at implementing. As vaccine supplies increase, you will hopefully see much more of that, because you're absolutely right. That's where people feel most comfortable. That's where the expertise resides. And so there was a question from Patricia Hanzo about misinformation. So in closing, I want to say a couple of things, but importantly, do not fall for misinformation. And do your best not to abet its spread in any way. As Jenna mentioned earlier, vaccines have done more to improve the human condition, to increase lifespan and quality of life than anything that man has ever invented. And we shouldn't forget that, despite the noise and kind of that irresistible impulse to question and to doubt. And so we should be grateful for that. And we also need to be patient. We are going to get through this. This has been a challenging time for everybody, but believe it or not, we are in the second half of this very trying experience for Americans, for Californians. And we're going to get to the end. It is getting better. We will get through this. And I know I speak for Senator Min. I'm grateful to be here. I'm grateful to serve. And we're both committed to doing whatever we can at the state level to ensure that we get through the pandemic as quickly and as efficiently as possible, that we take care of the people that are most impacted. And just importantly, once we're through it, that we rebuild California and we never go through this kind of experience again. So thank you for having me.
Thank you, Senator Newman. And thank you all for joining us today. I would actually revise Senator Newman's comments. I don't think we're in the second half. I think we're in the fourth quarter, and we can see the end of this game ahead of us. We just need to forge ahead right now, and vaccinations are going to be critical to getting us out of this. I think hopefully by this fall we'll see some return to some semblance of normalcy, but mass vaccinations are going to be critical for that. Now, as some of the panelists mentioned, on March 15th, we're going to open up the eligibility for vaccinations to a number of people under the age of 64, including those with different types of health conditions. You can check out different resources, including our website, which is going to unveil a COVID-19 page, I think, any day now, but also the state websites to figure out your own eligibility. But it's going to be critical to get vaccinated. These vaccinations are safe. They do not have microchips. They are the most effective way to try to head this thing off. And it's going to be critical to getting our economy back on track, to getting our lives back to normal. I know we're all tired, but let's vax up. Let's make sure we continue to wear masks and social distance. This is how we can get our country back on track, in our state and our community. But thank you so much for participating, to our panelists. Thank you so much to those of you who are watching. Please spread this information out in your communities. This is really, really important. And as Josh mentioned, misinformation is going to be the biggest challenge that we face going forward in trying to get folks vaccinated. And we need to combat that every way we can. But thank you so much, and enjoy the rest of your Wednesday.